the Chambalathyadi or Eladigaram, etc. Or even Murivanna is okay for such cases. But be careful that in a weeping stage, do not give or do not apply the oil or ointment type of medicines. There you need the best one is the Triphala Churna. It is boiled and this quadha is taken, dip a piece of cloth, a lengthy piece of cloth, dip in it and wrap it. So keep it there for some time. And once it is dried off, you add either you can add this Triphala Quatham or take that cloth again, dip in Triphala Quatha and again wrap it. So that is of immense help. Once the oozing is stopped and there will be a little bit of itching so that the Arovana Swabhava can be seen, then you can apply the oil. Till that, do not take any oil for them. And this is actually it is we may feel that it is a healed one. Actually, it is not healed. This is say non-healing ulcer from leeches. Once we enter the forest area or sometimes some marshy places, sometimes the leeches may get into such type of may give such type of problem, and non-healing ulcer may develop, and the usual medicines will not give much help, and see it will result in such appearance, and occasional itching will be there. Sometimes a little bit of watery oozing may be there. Here, the best medicine is Nannari, Manjalum, Neyum, Jaluga, Vishanashan. This is from Vishajosniga, the book Vishajosniga. And say very simple medicine. The Nannari means Shariba. Shariba, then Manjal is Haridra. And Ney, that is ghee. That's all. Prepare a ghee like this and you need not take too much time. Just some say 10 grams of each the shariba and dried haridra is taken. Then some 50 ml or 100 ml of ghee is taken in a pot. Then put in it, just warm it up. Then till there is a smell of the nannari, the shariba comes out, you stop it. Or if you feel such a difficulty, 2-3 pepper without crushing can be applied there. Once the correct paka is there, then this pepper will burst out. Stop it, bring down, and after getting cooling, you can fill it in a bottle and apply. So it's very excellent drug. Even though it is very simple, it's an excellent drug. Without this, it is very difficult to get healed. Even months or even years may be there like this. This is in our, while I was in service, there was a patient of endosulfan manifestation, Kasaragod northern part of Kerala, was there, and very difficult to treat, but it was not in my department, even though I went there and take the picture of because it was so important. But he got a special permission from the government to stay there and to get the treatment like that. But now he's a very nice fellow, a handsome fellow, and now he is studying in the school in here itself. It means at Tripundra itself, because the whole family shifted to Tripundra for the treatment of this child. And now I think now he is about 10 or 12 years old. And some viral section. This is the herpes. You can see the the papules. There is no pustules, only the fluid filled, serum filled papules can be seen there, and only in a very special area. See, see. Okay, see. This area, there is a wherever there is the branch of the nerve goes, there only it comes. So that's a very special clue in diagnosing, and also burning sensation. The people say complain about it, and the white glistening small papules. See, only not on the both sides, only a single side it will be manifested here. See on the forehead of the left side of the patient. And actually this patient is a very what's a recent patient. But what happened, once we tried our medicines, etc., since he is very old, their relatives were in the US and they scolded him and not to go to the Ayurveda, and they went to the allopathic hospital. And only for one day he took our medicine. Then the whole thing washed off, and they went to their big hospital. Afterwards, some say, I want him, or I told him what is the course of the disease and how much time will it take, like that. So the time was okay with the allopathic and this thing, but he abandoned us for our treatment. Whatever may be, we have to give the Padola Darvyadi Quatham. That is from the Visarpa Chikitsa of Sahasrayogam. Padola Darvi Pijamanda Dikta Trayandiga Yeshti Prashambu Sadhitam. Like that much only. So make a quatha, and it is not available in the market. There you have to prepare the medicine, or those people are there procuring the medicine, making into a powder and giving. Some people are here. So we can give the prescription to those people, and they will give the medicine. So this medicine is very important. So Padola Darvyadi Quatha with Vilvadi Guliga. Then for the labam, Gomalpajadi Kradam. Kradam is better, but no, nowadays Kradam is not available, only coconut oil is available, whatever it may be. But in my experience, while I was studying in our college, the Gomalpajadi Kradam was available, and it was with the immense result we can apply this. So Gomalpajadi Kradam and Vilvadi Guliga, just powder it and make a paste with this coconut oil, Govardhana, or Govardhana Kradam is available, then apply over it. Because it is made in the paste with oil or Kradam, then it will not once dried off. It will be there. Once it is applied, it will be for quite some time, some 3-4 hours it will be there. But the burning sensation, the pain, everything will come down. But it may take 7 to 8 days. Well, that is the normal healing period, 7 to 8 days. That will be there without any problem, without any post-hepatic neuralgia. You can give this medicine. That is our experience. 2-3 slides are there. Then this is the Dedru, that is a fungal infection with a secondary infection. With the bacterial infection is there. Primarily it was a fungal infection, but additional bacterial infection was there. Then the appearance like this. So that's a typical type of Dedru or fungal infection. what we can do is Padola Kataripunyadi Kashai or Diktan Kashayam, then Kadirarishtam, Aragudarishtam, Nimbarasam, Nimbavrasavam. So you can use. Then Ela the Churnam in rose water. So it's a little irritant medicine is needed in case of fungal infections. So Ela the Churnam in rose water and Gandhagam in Jamburasam, powder the Gandhaga, sulfur, then make a paste with the Jamburasa and apply over that particular area that is needed. Then Nimbadi Churnam. Nimbadi Churnam is told in Ashtanga Hridayam. Then Vidpala Karam, in certain cases, that is okay. Vidpala Karam itself is okay. Or Gulgulu Maljadi can be taken. Then the patent items like Sora coat cream, Dermatint cream, etc. can be used. And in very rare cases, there will not be any response to such medicines. In such conditions, we can give the Chiratathaidam. Very important. I would like to make a warning that do not apply this Chiratathaidam directly on the area. Get it diluted with the coconut oil and apply to that particular area only. In the market, it is available with the Shantigiri people. Shantigiri Vaitishala. It's available in Kerala. Outside Kerala, I don't know whether it is available or not, but you can prepare it, this Chiratathaidam. That is also a little bit tedious work. That is just like Deepika Thailam, this Chirata means the coconut shell. So just like Deepika Thailam is taken, the Chirata, this coconut shell is burnt off and the oil is collected and diluted with coconut oil. Once again, I am telling this, that only after diluting with coconut oil, you shall apply it. 3 times or 4 times you can dilute it. Otherwise, that area will burn off. It's so strong. And this Indralutam, the treatment is Karshanam with Ficus exasperata. We see the name given to is forest sandpaper. In Malayalam, it is termed as Theragam, leaves of Theragam. That is very rough in nature. You can use, and the simple thing that teakwood leaf also can be used. Then aseptic measures should be taken. That is, either the leaves should be washed in Dettol solution and apply. Even these aseptic measures or this thing should be taken on the area and on the leaves also, and you can rub it off with these leaves, leaving the area. You can see small bleeding spots should be there. Up to that, you have to rub it and then apply. Well, once a day, once is okay. One time is okay. You can make this Karshanam and apply any fungal cream, antifungal cream. You can apply and with a good result. And for the first day after the Karshanam, you can apply the Muruvenna. That is better because it is there will be an open wound. Then you can apply that. Then this allergic to footwears in our OP department, a lot of such things may be there. Just remove it. That's all. Then apply some oil or something like that. Anyhow, we have to get rid of the cause. That is, Nidana Parivartanam is very important in such cases. You can see the marking of that chapels, V-shaped marking can be seen there. That itself gives you a clue for the diagnosis disease. And some melano genetic drugs also may be given. That's all. And of course, here we can do nothing. why I am showing this thing, that there will be a limitation for everything. For everything, limitations are there. So we don't say, or we can't say that all the ailments can be treated by Ayurveda or by us. No, there will be limitations. See, this is xanthomatosis. In hyperlipidemia and hypercholesteremia, the cholesterol deposit may be there, and nobody can do anything. Even the allopathy people are not able to do anything such cases. In our OP, he came to us and requested for this, and we told them that we can't do anything. Our helplessness, we have to inform him. Then another important case, you can see the pemphigus vulgaris. In my practice, some 5 or 6 patients of suffering from this type of problem came to us. Even a single patient was not survived by us. And nowadays, I won't accept such patient. Immediately, I will refer them to the allopathy section, and only the steroids can give them certain solace. Otherwise, we can't do anything. In such cases, we do not enter into it and make any attempt. That is my request. Then you can do as you wish. This is a very, very important drug combination, which was used in Trivandrum Ayurveda College. The formulation was from a Vaidya, an old Vaidya, and I don't know still now is there or not, but in almost all cases of weeping type of skin problems, you can give this medicine very nicely. The thing is that there will be purgation, but after 1 week, it is off. You will feel the goodness of the combination. It was called a Nimba Nilavagadi, and this Nilavaga is nothing but senna leaves, and it will show its effect definitely. So Nimba Nilavaga Khadira Abhaya Shariba. This is the original combination of Nimba Nilavagadi, and Nimbam Nilavaga Kharidra Ashwagandha Arabhatha Darvi. There is a modification of this combination was also there, and this Nimba Nilavaga Khadra Ashwagandha. This combination is much slower effect, but with a less the Virajana Swabhava. So it's a very, very nice combination. If you would like to experiment it, then I will advise. And Shonidamradam, Kwadham, there's only 3 medicines, Guluji, Abhaya, Shariba. It's a very good combination, giving immense result. That's very nice. You need not look for the doshic combination. We just give this Shonidamradam. That is of immense help. Then another yoga is Vashadi Vadha, Vasha Draksha Abhaya. When we look into this each drug, we may feel that what it will do in skin disease, but this is a very, very important combination of yoga, Vashadipada. This combination was tested by the, I think it is by the CCRS very long years back, and they gave or made a paper on this, and it was published. It's very good combination. Vasha, Raksha, Abhaya. Very nice. And this one is also very nice combination. Yes. Thank you. And if any doubt is there or any clarification is needed, you may ask.
Thank you so much, sir, for this wonderful session. You have in detail told us all the diseases and its diagnosis as well as the treatment aspect. So, once again, thank you so much from our participants and on behalf of Ayurveda Map also, sir.
Thank you. Thank you.
Sir, with your permission, can we go for the discussion part?
Please.
Sir, first question. Sir, whether the wound debridement to be done in venous ulcer before dhara?
Before Dhara in venous ulcer, what